Welcome to Heart Attack Awareness. If you're serious about preventing a heart attack, this might be the most important video you watch all year. But first, if you're new here, please hit that subscribe button. We publish life-saving, science-based heart health content every week. And subscribing helps us reach more people who may be just one symptom away from a crisis they don't see coming. Today, we're talking about an invisible killer. It doesn't make the headlines. It doesn't show up on your bathroom scale. And you won't always feel it creeping through your body. But it's there. And it's destroying your arteries from the inside out. It's called chronic inflammation. And it's one of the most overlooked causes of heart attacks worldwide. When most people think of heart attacks, they think of blocked arteries, cholesterol, or maybe high blood pressure. But what if I told you that even with normal cholesterol and no major plaque buildup, you could still be at serious risk? That's where inflammation comes in. It's not just a risk factor, it's the spark that ignites the heart attack. Let's break this down. Inflammation, in the short term, is a good thing. It's how your body responds to injury or infection. You get a cut, your immune system sends in white blood cells, the area swells, and it heals. But when inflammation doesn't shut off, when it becomes chronic, it turns from healer to destroyer. It starts attacking healthy tissues, including the delicate lining of your blood vessels. This lining is called the endothelium, and it's one of the most important parts of your cardiovascular system. It helps control blood flow, clotting, and immune function. When chronic inflammation irritates this lining, it becomes more permeable, meaning bad cholesterol can slip underneath and start forming atherosclerotic plaque. Here's where things get dangerous. As plaque builds up, your arteries narrow. But a heart attack doesn't usually happen because of slow blockage. It happens when that plaque becomes unstable. Inflammation makes the plaque more likely to rupture, and when it does, your body forms a clot around it. That clot can suddenly block blood flow, leading to a heart attack. In other words, cholesterol loads the gun, but inflammation pulls the trigger. One of the most alarming things about inflammation is that it's silent. You can't see it or feel it, at least not at first. But it leaves clues. Blood tests like hs-crp, high-sensitivity C-reactive protein, can detect it. CRP is produced by the liver when your body is in a state of inflammation. Elevated levels are associated with a higher risk of cardiovascular events, even in people with normal cholesterol. In fact, a groundbreaking study called the Jupiter trial showed that people with normal LDL cholesterol but high CRP levels were still at significant risk of heart attack and stroke, and those given anti-inflammatory treatment via statins had dramatically fewer events. So what causes this inflammation? Several things, and many are part of everyday life. Let's walk through the most common triggers. First, diet. Processed foods, refined sugars, trans fats, and excessive omega-6 oils, like soybean and corn oil, are all highly inflammatory. These foods spike insulin, damage blood vessels, and create free radicals, molecules that oxidize cholesterol and worsen plaque buildup. A diet that's heavy in processed meats, white bread, fried food, and sugary snacks is like pouring gasoline on the fire. Second, visceral fat, the fat stored around your organs. Unlike subcutaneous fat, the kind under your skin, visceral fat is metabolically active. It secretes inflammatory chemicals called cytokines, which circulate through your bloodstream and keep your body in a state of low-grade inflammation. That's why waist size, not just weight, is such a critical marker of heart disease risk. Third, chronic stress. When you're under constant stress, your body releases cortisol, the stress hormone. Cortisol can increase blood sugar, suppress immune function, and, you guessed it, ramp up inflammation. People with high levels of psychological stress are significantly more likely to have a cardiac event. Not just because of lifestyle habits, but because stress physically affects your arteries. Fourth, poor sleep. Inadequate or disrupted sleep elevates CRP levels and contributes to systemic inflammation. Sleep is when your body repairs itself. If you're not getting 7 to 8 hours of quality sleep per night, you're missing the chance to lower inflammation and heal arterial damage. Fifth, sedentary behavior. Lack of physical activity is strongly linked to higher inflammatory markers. Even light movement like walking has anti-inflammatory effects. Sitting for long periods increases your risk not just because of circulation issues, but because inactivity disrupts your metabolic balance, raising inflammation in the blood. Let's not forget smoking and air pollution. Smoking directly inflames the lungs and blood vessels. Fine particulate matter in polluted air also causes systemic inflammation and oxidative stress, which is why people in high-pollution cities have higher heart attack rates, even when other factors are controlled for. So what can you do to reverse or reduce this inflammation before it triggers a heart attack? Let's start with anti-inflammatory foods. These are your best defense. Number 1. Leafy greens like spinach, kale, and arugula. They're loaded with antioxidants, fiber, and vitamins like folate and vitamin K, all of which protect the endothelium. Number 2. Fatty fish, especially wild-caught salmon, sardines, and mackerel. Rich in omega-3 fatty acids, they counteract the inflammatory effects of omega-6 fats. Omega-3s also stabilize plaque and reduce blood pressure. Number 3. Berries, especially blueberries, strawberries, and blackberries. These fruits contain anthocyanins, powerful antioxidants that have been shown to reduce CRP and improve vascular function. Number 4. Extra virgin olive oil. High in monounsaturated fats and polyphenol, olive oil has been shown in the PREDIME study to reduce major cardiovascular events when consumed regularly. Number 5. Turmeric, especially when combined with black pepper. Its active compound, curcumin, has been shown to reduce CRP and other inflammatory markers. Also helpful are nuts, avocados, garlic, green tea, dark chocolate, and cruciferous vegetables like broccoli and Brussels sprouts. Let's talk lifestyle. One of the best anti-inflammatory medicines is movement. You don't need to run marathons. A brisk 30-minute walk 5 times per week is enough to lower inflammation markers. Yoga and Tai Chi, which combine movement with breathing and stress relief, are particularly effective. Breath work and meditation are also powerful tools. Just 10 minutes of slow, diaphragmatic breathing per day has been shown to reduce cortisol and systemic inflammation. Apps like Insight Timer and Headspace can guide you through these simple but transformative routines. Sleep hygiene matters too. Go to bed at the same time each night. Avoid screens an hour before bed. Keep your room cool and dark. Avoid caffeine after noon. These small changes can dramatically improve sleep quality, and with it, your inflammatory profile. Let's not forget supplements. Some evidence supports the use of omega-3 fish oil, curcumin, magnesium, and CoQ10 as anti-inflammatory agents. But always talk to your doctor, especially if you're on medications or managing other conditions. If you suspect chronic inflammation, ask your doctor to run an hs-crp test, a fasting insulin level, and a homocysteine test. These can help you see if you're silently at risk. And here's something powerful: chronic inflammation is reversible. Within just a few weeks of eating anti-inflammatory foods, getting better sleep, moving your body, and managing stress, CRP levels can drop significantly. The damage doesn't have to be permanent, but you need to act now, before inflammation becomes irreversible plaque. Let me leave you with a real story. Linda, 64, had no obvious risk factors. Her cholesterol was fine. She exercised twice a week. But she constantly felt tired, had aching joints, and frequent digestive issues. Her doctor ran a CRP test, and the results were sky-high. They traced it to her high-processed diet and poor sleep. With guidance, she switched to a Mediterranean-style diet, began walking every morning, and started taking turmeric. In 3 months, her CRP dropped by 75%. Her energy came back, and her heart was safer than it had been in years. This is what's possible when you treat inflammation at the root. Don't wait for chest pain. Don't wait for the sirens. Your heart attack might start with fatigue, poor sleep, or a fast food craving. But it can also end right now with a better choice. This has been Heart Attack Awareness. Thank you for watching. Please subscribe and share this video with someone you love. You never know whose life it might save.